Your Senator from Virginia Beach, Senator McWaters.
Thank you, Mr. President. I rise on a point of personal privilege.
The Senator has the floor.
Thank you, Mr. President. I agree with many of the comments that have been made today, but the one I most particularly agree with is the comment of chaos, because that's what the Affordable Care Act is in right now. It's in chaos and potential complete meltdown. Mr. President, just today, from meetings that were conducted with the insurance industry over the last several weeks, the President appears to be contemplating changing the rules significantly again, this time on the commercial side. Now, we know it's been reported that some 7 million Americans have lost their insurance. Hardworking insurance policies that they had kept over the years, some 7 million have lost their coverage. Mr. President, I'm going to suggest to you that millions more will lose their coverage because of the chaos we're in under the ACA. And so the President has decided now to do his best to keep his promise that if you like your insurance program, you can keep it. If you like your doctor, you can keep them, by extending for somewhere between 1 and 3 more years the requirement that policies meet the ACA requirements. I've talked to many of you in committees and on this floor about the fact that perhaps in excess of 1 million Virginians will be faced with losing their insurance policies this fall because of higher premiums and out-of-pocket costs, and because their insurance policies don't meet the ACA requirements. Well, now it looks like, Mr. President, that the President of the United States is going to take an opportunity to change those rules as well and phase that in over some period of time. Well, 2 things will happen. Number one, in Virginia, I have no clue what will happen. I've asked the SCC. I know in the past when the President said you could keep your policy, Virginia did not participate in that. And now going forward, we'll have to make the decision how we participate in yet another massive change. But the biggest change that this is creating in all of this is something in the industry we call a death spiral. And the death spiral is when sicker or more elderly patients, those who need services, sign up for insurance, and younger patients and people who can't afford it, that may be younger or may not have a health care issue, don't sign up. The insurance pool has a tremendous negative risk effect. And so I believe that it would, while I agree we have a problem and while I agree we have to find a solution, this is not the solution, this is not the time. We need to spend more time understanding our options and understanding what is going on in a program that is melting down and that's a part of an economy that spends $90 million per hour, more than its revenues. I'll say that again, Mr. President, $90 million per hour more than the revenues. That's the bank account balance for the folks that want to give us this money to fund this broken program. So I could say more on it. I know I spent 12 minutes and 33 seconds the last time I spoke about this, so I'll cut it off at this point. Thank you, Mr. President.